Hi, everyone. Wanted to thank you all for joining today. My name is Patricia Cronin. I'm the Development Director with Worker Justice Center, and I have joining us the worker advocates for our outreach and education programs. And we just wanted to take a few minutes today to kind of share how our work has changed since the health pandemic started and how we've been responding to the needs of our clients. And also, recognizing the support that many individuals and foundations have given to our organization to transition our work to be digital and remote. So I wanted to give a little bit of an overview of how that's been going. So first I wanted to just provide the space to have the advocates themselves introduce themselves and share a little bit about the work that they do. So go ahead.
Hello, my name is Paola Betchart, and I'm a senior worker rights advocate with the Worker Justice Center of New York. I'm based in the Rochester office, and I've been with the organization since 2013. So it's been a long journey, and I'm still here trying to adapt, and we'll be talking more about this, but trying to do the best we can to serve our community.
Hi, everyone. My name is Erika Aguilera, and if you hear a baby in the background or some music, that's my baby nephew, Sebastian. I'm currently babysitting. So I joined the team in August of last year. So it's going to be a year now in August as a worker rights advocate. And so that's where I'm at.
Hi, everybody. My name is Cristian Ávila. I'm a worker rights advocate out of the Kingston office, and I've been with the organization for 3 years now.
Great. So first I just wanted to ask, how are you all doing personally? How has the transition to working remotely been for you, and some of the struggles that you have, and then also just generally how you're feeling?
Well, in my case, it's been quite the change. I just came back from a caregiver leave, a maternity leave, so dealing with an infant and a toddler during this time, it's been very challenging. By now, we have sort of like a rhythm, but still feels very complicated, and at the same time, dealing with all the needs of the community, we are seeing that the pandemic is really affecting more people of color and of course, many of the workers. We help agricultural workers. Many of the workers, essential workers, happen to be people of color. And I think that we are seeing in the world and in the country that there's more and more asks to get more justice and equality. And I think having to respond to all those needs and at the same time deal with the everyday needs, it's challenging. This pandemic just has exacerbated what we already knew, what we were already working with. So it's going to be an interesting time for us to, as an organization, as a society, to look at how we are working, who we're working with, and how we are trying to make changes in the world. So I'm struggling, but also hopeful that we are trying to do our best. Yeah.
Thank you.
Yeah, the transition, I think it took some time for me to be able to navigate this new reality that we were living in, given how much of our time was spent, driving out to locations, connecting with people in person. And once that element is removed, you feel a little bit dislocated. Yet the work, it doesn't mean the work is no longer there. It just, as Paola mentioned, a lot of these situations are exacerbated. And oftentimes the phone calls we receive are from folks in situations of crises, in which, you know, they don't know where else to turn, and they've called us at 6 in the morning or some other hour that is very unconventional. But that's how, with from the template of the relationships that we had prior to this pandemic, of trying to meet people where they're at, and that's carried over. And now I think it's been an ongoing effort to make sense of how does it look like in this new context, where we can't reach people, we can't go to people's homes to be with them, to accompany them through some of these difficult situations. So we have to be very crafty in terms of engaging with other community partners, engaging with within the framework of social distancing and, you know, the protections that are in place to protect workers, which, as you know, Paola mentioned, a lot of vulnerabilities that are inherent in the workers that we are in the service of. And also being mindful of we don't want to be the vector of contagion here, of getting other people sick. So it's just been very difficult balancing this all, but I'm hopeful that the insights from this experience will be better prepare us to do our work in a variety of ways.
Absolutely.
Yeah, I think, yeah, I really agree with what, you know, both Cristian and Paola have said. I think that during these times of uncertainty, it's really created an opportunity to find creative ways to be solution seekers. And we know that there's these barriers now, since we're so used to visiting workers, you know, on a consistent basis, and just showing up and, you know, doing trainings and just like talking to them and just to see how they're doing about life in general. And so I think that this time of uncertainty has brought a lot of reflection in ways, and has allowed us to reflect and see, okay, so these are the obstacles that we're facing right now. What are some solutions that we'll be able to find where we can still serve the community, even though we won't be able to, you know, to show up to where they live. And, you know, fortunately, some of that has been through virtual communication. And so I think that the technology that we have today, like Zoom, the WhatsApp, the video chat has really been a good bridge of communication, and a good bridge of still being able to connect with the community, the people that we've already known and served in the community, and just to see and follow up and see how they're doing. So yeah, it's been a lot of uncertainty, but we're figuring out as we go along, since this has never happened before. But yeah.
Yes, these definitely strange times we're living in. You know, I heard from the three of you, you know, just the importance of having that space to build relationships in person, and just the amount of driving and in-person, you know, relationship building you all have done in the past, and using technology now to try to bridge those gaps. And would love to hear a little bit more about the types of trainings you're doing online, what kind of digital tools we're using, and kind of like how the response has been from the clients that we serve.
Well, I came back at the end of April, and this already had been happening, the pandemic. I think that WJCNY was adapting in the ways that we do this outreach, right? And so utilizing Facebook, for example, to engage with workers. We know that we had, and it has been an intention for the organization to communicate in many ways with the community we serve, and recognizing that also the community we serve has a presence in social media, especially Facebook. For example, I and some other members have created Facebook accounts that are specifically for work. So where this is really a forum for us to communicate and to keep a community in a way. So I was lucky to be able to just reactivate those resources that we already had, and then utilizing these other tools like Facebook Lives that we've all been doing. And if you go to our Facebook page, you can see all of us talking about different topics each week. Today I'm actually doing one at night about H2A workers, and we are also inviting other community partners to join in with us and share their expertise as well. So tonight we're going to be talking with people from the CDM, the Centro de Derechos del Migrante from Mexico. So it would be interesting to have, this discussion of what's happening in the other side of the border, and how the workers come in here in New York, and what are the laws that protect them. So we always say that if workers don't know their rights, it's like if they didn't have them. And so that's why it's so important for our team to communicate all these tools, these laws that they have, so they can really empower themselves and know what their rights are, and that they know that in the case that these rights are violated, that they have some place that they can go to and get assistance. Then we have other tools, and it's been very interesting to figure out all these transitions also, because you can see in some of those videos that there's a baby crying in the background, or suddenly a person walks in, and those things are just a reality that we're living. We are all from our homes trying to do the best we can, but I think that everybody understands that, and even from the workers, I've seen like some messages, encouragement messages in my Facebook, just saying, yeah, thank you. Or so there is still some sort of community that we are able to keep, but of course it's not the same as going in person, and we understand that we need to keep engaging with the community as much as we can through all these tools that we have.
Great. And, speaking about the responses you're getting from the clients, I would love to hear a little bit more about how the pandemic has been affecting the people that you engage with through your outreach. What are some of their biggest needs right now? And, if for those who aren't directly working in this kind of work every day, like, do you have a message of what you wish people would know about the pandemic and agricultural workers?
Yeah, so I was, seeing if Erika wanted to hop in first, but right now the pandemic, as we mentioned before, has really exacerbated a lot of the vulnerabilities that a lot of our communities throughout the state have, and the vulnerabilities are rooted in precarious employment situations, jobs that, if they miss a day of work, it jeopardizes the budget of the family for that whole month. And, being torn between presenting symptoms of being sick and possibly of being afraid of being fired for not going to work. So these are choices that oftentimes folks, despite what the legal framework that protects workers, if folks aren't aware of how to access these benefits, aren't aware of the protections that are in place, oftentimes they will sacrifice their own health to ensure that they can maintain the material needs right now. So it's been incredible. Sometimes, in the course of some of the conversations and ongoing, for example, with the partners in Sullivan County, we were doing every Saturday night My joke was that it was Sábado Gigante. Every Saturday night at 8 p.m. at a time when, you know, folks in the community can participate. We were engaging in a conversation, a town hall with other organizations and other folks that are interested in making sure that community members have the right resources and information in this moments of a crisis. At that juncture, the COVID numbers were rising throughout the county. And, you know, from the context we established there, we're fielding phone calls where people are calling us, hey, should I go to the doctor's office, or can I go to work? Should I go to work? And in the moment, you know, people have the trust to communicate with us and ensure that they're putting themselves and their livelihood and their well-being of their family ahead, and not just being torn in the direction of the fear being the driving force here in terms of putting themselves at risk, putting other people at risk. And so, yeah, it's been finding creative ways to ensure that people get the information and know that there's backup if they need backup on addressing some of these workplace injustices.
In agriculture now, I think it's very concerning that there's not a specific guidelines on how to respond from the employer. Like the governor released guidelines on health and safety, but there's no binding. There's no way to enforce this. These are not laws. And we saw a big outbreak in Madison County in a nursery where were hundreds of more than, I don't know, it was perhaps, I don't remember the exact number, but it was almost 200 cases in one place. And because of the housing situation and the nature of the work, it's super hard to keep folks separated. And it is a very big concern that more of these outbreaks will happen around the state. And what are the employers doing, and what's the Department of Health is doing in each county about this? So we want to make sure that the workers are safe, and we ourselves want to be safe. So it is a very difficult time. We have facilitated some complaints of folks. We've heard that they've been retaliated against, given less hours after they've been in quarantine, for example, and they were either fired or they decided themselves to quit because they weren't making enough money to pay the rent. So it is concerning. Also, we know that many employers discourage the workers from going to the doctor if they have symptoms, because that might mean that they have to shut down operations. And so we will need to be very proactive in just talking about these issues and talking about the laws that protect the workers, but we also are facing the reality where we have so many farms, and there's now the HCA workers that are coming. How we're going to get there, and I think we need the solutions at many levels. Of course, we are going to provide information as much as we can, but we also need the public to be aware, and people to ask for better protections for workers. We are currently supporting different legislations in the federal level and in the state level to have better protections for essential workers. And we hope that those will be heard and that we will actually have more protections.
Great, thank you for sharing that. That was really powerful. Before we wrap up, is there anything else any of you want to mention, or if people are looking for ways to get involved, do you have any advice?
There's something I'd like to mention, and now we have baby Sebastian in the in the mix too. But no, anyways, I think that another good, creative solution that we found during these hard times is using the technology to still be able to serve the communities and to do the work that we did before. An example of that are the virtual family preparedness clinics that we've been doing. And it's been a collaboration with the LSP of Rochester and the Cornell Farm Worker Program. And so it's been amazing that we have, like the platform of Zoom, and WhatsApp to be able to have these video calls and to still have clients to be able to have whatever documents or consultation, with immigration lawyers. And all of these services are free. So I feel like using these platforms, using the resources that we can to still connect and serve with the community has been a work in progress. And so, so right now it's like we're just trying to find solutions to these obstacles that this uncertainty throws at us.
Yeah, and the family preparedness clinics have been supported by the Hannah S. Cohn Family Foundation, and we're just incredibly thankful to them to providing the ability for us to move those to be digital. So lots of work going on, and I know you're all super busy, so I want to wrap this up and just thank you for taking the time today to kind of share your experiences right now. And always lovely to see little baby Sebastian. So I will sign off, and just if people are interested in learning more about our work, they can visit our website at www.wjcny.org. And have a great day, everyone. Thanks.
Thank you.